I mean, he can drive it when he gets big enough to do it, but for now, it's on remote.
Proper inlet.
It is good until you stop.
This is just.
Stop and he starts squawking, you know.
Looks pretty good, I mean, as far as. What that do.
Go to the vet,
It's all
pick up
come about when Detroit,
a dog today.
Detroit for drinking water.
Oh, that'll happen.
Yeah.
It was something we
The
got,
government got.
this is just a matter of information,
Yeah.
And water.
I'm sick.
Was, well, they have a lot of stuff in.
Yeah.
Cut him open. I need a washcloth or something stuff he's got.
No.
I'm sorry.
At 6 o'clock, we'll call this meeting to, this public hearing to order. Would everyone please join me in pledge? I pledge allegiance to the flag of
The United States of America. To the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, roll call, please. Here.
Councilman Oxford,
Here.
Councilman Flutie,
Here.
Councilman Parkhurst.
Here. Okay, we'll move, at this time, I'm gonna turn it over to Emery Pinner to explain some of the guidelines on this lead and copper SRF funding.
Good evening, everybody. So this public hearing is for the public to have an opportunity to comment on our upcoming project to acquire some lead service line funding to help us complete a pot line project that will make us compliant with EPA's lead and service line regulations that have been implemented by them due to their revision of the lead and copper rule. We have been working on an inventory, acquiring photos, digging through records as best we can to get a compliant inventory. We've submitted that on time. as of November 2025. And now we have to continue on with a verification project of the data that we have or the unknowns in the system that we didn't have data for. So to that end, we submitted for some funding through the state to help cover the costs of that potholing project up to $1.75 million. We are expecting a reasonable amount of principal forgiveness to fund the poor rest of that project. And then anything left after that is going to be a zero interest loan through the state. The state has a significant amount of funding that has been handed down through the federal government to help people comply with this inventory. So the plan now is to have this application submitted, approved, design the project this winter, and then execute the project later this spring. Greg Kopez from Engineer Associates is here. He is our lead engineer on the potholing project and helping us execute the inventory so we can be compliant with EPA. If you guys have any questions, we'd be happy to answer them.
How many areas are we looking at approximately?
So we're currently right now, we have 270 unknowns. Those are scattered in three main areas throughout town. We have some here downtown, some up on the south side of town, and then a few kind of scattered throughout. And those are just lines we didn't have records for. And we also have to verify a certain amount of the ones that we did have records for.
2 points verification.
Yes, and so that means on the customer side and on our side.
Correct.
Verify that. And so the customer side is actually the biggest driver of this project is we have several records from projects we've done in the past, but we don't have records of a lot of the lines that were put in by customers because that's not our line. We didn't put those in. So, but the EPA is still making us verify those.
Questions? Council?
I'll also say right now, like, we don't have any lead tests that come back negative. Significant amount of lead that we are aware of, any means in our system. We still have to go through this project. So we've actually been getting a lot of pictures from customers in the area. We were able to use some of our ordinances from the past and regulations that were implemented by the federal government that said, such and such past this date, lead is no longer allowed to be used as a building material. So that eliminated a lot of houses that were built after, 1980. And then we actually had an ordinance that went in 1976 that said it had to be copper. So they allowed us to use that as like a verification of somebody not using lead. And then the ones that are left will have to go on their side of the meter, pothole down with a back truck and actually see what it is.
Were these the pictures you guys were asking us to take
Yep.
of our
And if
service coming in?
correct. And if we were able to get a picture from somebody of where their service came in underneath the house, that actually qualifies as a verification too.
We got a fairly good return on those.
Yeah, we did. That reduced the scope significantly. And that's part of the reason the funding number was where it was, is because that was submitted prior to some of that coming in. So we don't expect using all that funding.
It's actually come down from the federal government. It's not something the town thought of doing.
Any other questions?
Thank you, Emery. What I'll do is I'll give it 5 more minutes. And if we have no other questions, move to close the hearing. Okay, last chance for any questions. Do I have a motion to go ahead and close this public hearing?
I'll make a motion, to close public hearing.
Do I have a second?
I'll second it.
All in favor?
Aye.
Okay, we'll move on to the council meeting. Everybody, already had roll call and everything. Everybody had a chance to look at the agenda? Do I have a motion to approve the agenda?
I'll make a motion to approve the agenda.
Do I have a second?
I'll second it.
All in favor?
Aye.
Aye.
Opposed? Okay, we'll move on to approval of the minutes from the August 5th meeting. Are there any questions or discussions about that? Do I have a motion to approve the minutes from the August 5th, 2026 meeting?
I'll make a motion to approve the minutes from the August 5th, 2026 meeting.
Do I have a second?
I'll second it.
Any more discussion? All in favor?
Aye.
Opposed? We'll move on to approval of the bills. We had deposits in the amount of $310,405.08. Accounts payable in the amount of $236,556.43. Transmittals in the amount of $55,804.89. And payroll in the amount of $49,416.17. Questions? Do I have a motion to go ahead and approve the bills?
I'll make a motion to approve the bills.
Do I have a second?
I'll second it.
Any more discussion? All in favor?
Aye.
Opposed? Okay, is there any correspondence? No. Okay, we'll move on to items from the public. Mr. Faust?
Mr. Mayor and Council, how are y'all tonight?
Good, how are you?
doing?
Good to see you guys. Sorry, I gotta get my notes up here. And we've got some other guests that are with the hospital that's here. I was hoping I could kind of give you guys just an update on a couple of, we had a grant that came through and just kind of a quick board update on some procedural stuff that we've been working on. And then I'd invite Dana Gilliland up, our CEO, to give just a little bit of a brief business update, operational update for you guys, so we can kind of keep you in the loop.
Thanks for coming.
Yeah, appreciate you guys having us. So a couple good pieces of good news. Number one, I want to thank the council for your all support on the 340B drug program. I believe we've been conditionally approved for that. I think that's the right word for it, but this is going to be a big deal for not only our hospital, but our community. It allows us to, and our patients, to gain access to drugs at a much more affordable cost.
Great.
And so that's great. And that was kind of one of the reasons I was here last time. The second bit of really good news that we've got that I'm going to share is 2 weeks ago, we were awarded, the North Platte Valley Medical Center was awarded $1.75 million from the Rural Health Transformation Fund grant process through the state. And so these are federal funds that were distributed to Wyoming. And I think it was 205 million total came to the state. And this is kind of the first round of things. But we're super excited that we were awarded this much. It's not all in the bag yet. The rules are not very clear on exactly how we're going to be able to kind of spend some of these dollars or the strings attached with them. But what I can say is they aren't going to hurt us, right? And so what we're doing right now is working with the State Department of Health, trying to understand the rules a little bit better. But really, these are things that Dana and I, along with several of the other board members, did get to go to Washington, D.C. over the summer and lobby and advocate for rural communities. And so we're pretty excited to be putting some of this into place. The idea is making rural healthcare more sustainable and in improving access to healthcare is kind of the gist of
No, that's fantastic.
yeah. So
That's great.
so real excited there. And with that, I would open it up to any questions from you guys, from the board to our board.
It was my understanding that the ambulance went out on their own and they were denied.
Yeah, and I think, yes. There's some disappointment from our board's perspective. And Chuck, you and I have talked offline about this. We've been trying to make overtures over the last year, behind the scenes with the Schwems board, both from a chair to chair communication and board to board. We thought we had come to some level of agreement. There was a very large pot of money that our community missed out on. And we're talking millions that was designated just for helping fix and sustain rural emergency medical services, EMS responses in rural communities. The caveat in the way that the grant was worded is entities that were eligible to apply were ambulance services that worked in conjunction with critical access hospitals. And there's a couple reasons for that. One is, and it's my understanding that the billing for the services, you can get more preferential rates, meaning you're doing the same amount of work, but the way that Medicare, Medicaid pays is you get paid a little bit more. So that makes ambulance services more sustainable. We had met over the past month with various members of the Schwems board, thought we had come to agreement in a meeting you were at, Chuck, the Monday prior to the deadline. We, in the spirit of that, worked on our side of the application, worked on theirs the Thursday night at 8:00 prior to, I think it was a Sunday deadline. We received Schwems' copy of their grant, which then Dane and I spent the entire next day melding the two together to make it look like a collaborative project. There was capital expenses asked for about 1.25 million. And with kind of the understanding that the two entities would have to be working closer together in the future. Now, whether we would have gotten that grant or not, I don't know, right? And so that's fair to say. But the timeline suggests, and I would welcome any of Schwems' actual information. But by the time they had sent us their application, I believe they had already filed theirs, and their application made no mention of the North Platte Valley Medical Center. Which automatically took us out of the running. We did go ahead and submit after, consulting with you and a few of the other mayors in the valley, said, hey, let's throw ours in there. It's my understanding in talking with Sue Jones, who I have not talked to, let me be clear, but several of our other board members have, it was pretty much a red flag when one entity put in saying, hey, we want ambulances and we're not going to change anything. When ours said, hey, we're going to, kind of start maybe looking and exploring this new structure. So not trying to throw anybody under the bus, but I do believe our board has decided that it is time to make some of our frustrations public, because it's not necessarily really, there's some effects to our business, but this affects our community that we live in. And that's the most disappointing thing to me, is that there is no reason why two nonprofit volunteer boards can't get together and work together for the betterment of the community. We all have health concerns. We all have parents that live here. The one thing standing between all of us in this room and that hospital up there is the ambulance service. And we need them to quite frankly, we need their help, and we need them to start cooperating. So. Not trying to throw anybody under the bus here,
No,
but that's the reality of how it.
I was as surprised as you were, because I sat in on their last meeting, and I thought there was total agreement, the way it left the meeting. I mean, there was some issues that needed to be ironed out, but that would have been taken care of in the MOU, the agreement.
I would think so, and a lot of this, it may. I don't want to be hyperbolic, and I don't want to start pointing fingers, because the time frame that all of us had to apply for this grant was very strained, meaning shorter than any normal organization.
Less than a week.
Yeah, it was, guys, it was really quick. And so we were up against a wall there. There are second rounds of this grant, we believe this time next year. And so our hope is these two entities can come together to go after some of this money and fix some of the problems that we've got. And I don't have the stats for you guys today. But you know, our biggest frustration really from the hospital's perspective, and this is I know we lack volunteers. I know it's a thankless feeling. I understand all of that, but sooner or later, when we can't get people out of the valley when they need more definitive care, we've got problems. And you know, Bob, it could be your daughter, right? It could be somebody's mom, somebody's dad. We've got to start thinking differently as a group. You know, you guys appoint the Schwimm's boards members. They work at the behest of the mayor. And if we don't start working together on this deal, somebody's going to die. Well,
That'll be a goal.
yeah. But we're here. Our board's arms are wide open. We want to work with you guys. We want to work with Schwimm's. We got to work with Schwimm's. Like it's gotta work. Any other questions, guys?
Not at this time.
Thank you, sir.
Great.
That's really great about the money.
Yeah, no, it's great. And I'm excited because Dana's got a lot of great things to talk about. There's really good stuff happening. So thank you.
All right, thanks, Bob.
Hello, gentlemen.
Hello.
It's good to see you again. So we have a couple of updates we want to give you. Obviously, the RHTF funding, very, very huge for us as a facility in order to move healthcare forward in the Valley. It's been a huge win for us. The summer has been extremely busy. The hospital has seen volumes unlike which it has never seen in its history since we've been here. Currently, right now, we are what we would consider full. We do have room in our long-term care for anyone who wants to be there, but on our hospital side, we are almost completely full. We have several individuals who have stepped up and really offered their support to help take care of those patients in our community. And we have seen a lot of attrition from other hospitals come back to us, whether it be staffing or patients. Right now I have a volume of 7 plus 1 inpatient, and it's busy. It's very busy. The ER is very busy. We've been doing more with the resources that we have so that we're able to care for more of the Valley. We've added not only different service lines, but in addition to that, we're in the process of onboarding 6 different specialties that will be visiting the Valley, including OBGYN. We're going to have cardiology. We're going to have podiatry. We're going to have a lot of different things that are going to be benefiting the Valley over the next 6 to 8 months. So we're really excited about that, so that way people do not have to travel out of the Valley for care in the middle of winter and jeopardize their life and their family to get to where they need to go. In the process of that, we have onboarded some new leaders as well and some new providers. And so I wanted to cover with you real quick, just kind of the list of providers that we have. I know always having an MD in the Valley was a huge concern of this community's. And so we have Dr. Maurice Speakman in the Valley, which he's sitting over there comfortably in his Hawaiian shirt, who is here full time and lives here in the community full time. We also have Dr. Brad Speakman in the ER, and he is on full time, is not here 24/7 the way Maury is, but does also cover the ER. In addition to that, we have 2 well-trained ER mid levels that also pick up shifts in the ER. We're going to be onboarding 2 other MDs as backup for those as well, so that we have the best possible care in the Valley that you can ask for. In addition, we also have Dr. Emma Biore, who is our geriatric specialist that comes over on Friday and who sees the aging population in our community. She stays very busy, and we're trying to gain access to more of her. And then on top of that, we also have a new gentleman with us tonight who is our new chief nursing officer who has joined us. Doug, why don't you stand up and introduce yourself?
My name is Doug Schlein. I'm fairly new here. Like I said, it's my second full week here. Beautiful community, I have to tell you guys. So I come with just short of 37 years of healthcare experience, doing everything from pre-hospital. Spent 16 years in flight. I've got decades of leadership experience, including some consulting and everything from critical access hospitals in multiple different states, all the way up to level 1 trauma centers.
So we're excited to have Doug, so you'll see more of him. We also, with his leadership and expertise for the nursing staff, we have been able to convert several travelers. And we have converted 4 over the past few weeks into full-time staff that are living in the community and staying in the community. And we want to continue to do that to support. And I will second Will's effort for the hope of working together. It is very discouraging for a CEO when their staff comes to them and says, we have no way to get a critical patient out. It's heart-wrenching. And when the family looks to me to solve the problem and I'm unable to. And I'm all about solutions. I try not to focus on the problems. There's a very limited and finite amount of resources in Wyoming, and I am very aware of that. But my goal is to make sure that I solve the problems for Saratoga, for Elk Mountain, for Hannah, for Encampment, for Riverside, not just one community, but all of them, so that we all can work together, so that we can do what's best for the valley, take care of the patients. Because it is a little concerning when they come to me and ask me what happens, and I don't have an answer for them. But overall, the hospital is, we had our first positive set of financials in 3 years, 2 months ago. We're in a good place to be financially sustainable long-term. So it's been a really long road, but we're there.
Good,
So we have more work to do though.
great.
Can I answer any questions?
Thank you. Thank you very much. I do have one question. On your cardiology, is that within the state or is that?
Yes, sir. They will be traveling from within the state. We'll also be adding, another one that we'll be adding is pain management. That one will be from out of state, but yes, we will be adding different rotations of all those and it will be within state. Our goal is to try to keep the care in Wyoming. And so that way you're not driving to Colorado or Montana.
So when you look at this, is this like one day a week, one day a month?
It really depends on when we're able to, it's the volume determines that. If it's 1 time a month, it's wonderful. If it's 2 times a month because we have the volume, then it would be 2 times a month. They really work at the best of our volume and what ultimately that drives their ability to be able to come. We're also adding back in MRI 1 day per month. And if it warrants 2 days per month, then we'll be able to do that as well. So our hope is to keep adding back as much as we can to continue to serve the community so they don't have to travel outside.
Great. That's really good news.
Been a group effort. Dr. Speakman's going to come up here and say a few words, so we're going to let him speak for you guys.
I like your shirt. I don't know why they're teasing you
I
about it.
tucked it in if I didn't know how to speak. I don't really have anything to say. Do you have questions for me?
Not yet.
I guess I can.
My shoulder hurts and.
I guess I can just give you a brief history. So I went back to school late. I joined the Army, who paid for me to go to med school. I did 21 years in the military, 8 years active, and the rest reserves. I just got out 4 or 5 months ago, something like that at this point. Went to the University of Utah, did my residency at Tripler Army Medical Center in Hawaii, which was where I got this shirt. So, and then served in Germany, Afghanistan, back to Germany, New York, and then went to Utah and then came here. Actually, a friend of mine who I deployed with to Afghanistan recruited me to come here, so glad to be here, I think.
We're glad to have you.
Yes.
We are.
Thanks, it's good to be here. Any questions?
Nope.
Great.
Thank you, sir.
Thank you, guys.
Thank you.
Yeah.
Okay, we'll move on to any council comments? I've gotta say this. I just want to thank Emery and the town crew for what they've done. I mean, they've got Elm Street pretty much wrapped up until next year, a little more paving, and they're doing a fabulous job over in Never Forget Park. Everything's coming together over there. So Emery, if you'd relay that to the guys, totally appreciate it. Okay, we'll move on to reports from town hall. And what we have under town hall is we have the vacant council seat. We received, thanks, guys.
Yeah, thank you.
We received 4 letters. Letters are from Joe Perry, Mark Wolford. And what we've done, Mark lives out at the lake, which he's gonna be disqualified. We call the county courthouse, and that is outside the town limit, so he will be disqualified. So we have 3. We also have a letter from Antoinette Maloney.
Dealing.
Didn't want to mess that up too bad. And also one from Megan James. I have read all the letters. But what I would like to do is I'd like the council to take the letters home, read them. I ask that you guys reach out to the council members, or you reach out to them, maybe catch them on the street or something and talk to them on why they want to be on the council, and then we'll make our decision at the September meeting. Everybody's in agreement with that. It'll be September 2nd will be the, we'll swear you the person in. Sound favorable? Okay. Is there any questions from 2 of them that are here? Do you have any questions? Joe? Okay. That'll be the plan we'll take. So the September meeting, we will be back up to a full council shortly after we get the meeting going. So, all right. We'll move on to, is that all from the town office? Okay, we'll move on to the police department. John?
Mr. Mayor, Council. We'll just go ahead and start with my first agenda item, which is the 3rd and final reading of ordinance 893. I'll go ahead and read that by title now. Ordinance number 893, setting forth maximum penalties in the Saratoga Municipal Court. Title is short and sweet.
You explain a little bit about
Yeah,
it.
again, that's just changing the sentencing guidelines in municipal court to where municipal ordinances, violations no longer attach the possibility of jail time, fines only. But it does still leave the authority for the municipal judge to sentence jail time for contempt or warrants or anything like that.
Questions? Do I have a motion to go ahead and pass ordinance 893 on its 3rd and final reading?
I'll make a motion to pass ordinance 893 on its 3rd reading.
I have a second.
I'll second it.
Any more discussion? All in favor?
Aye.
Opposed? Okay.
All right, thank you. The item I have that's actually not on the agenda is I had a meeting yesterday with the state guys from WyoLink. We're still in the process of getting a tower down on Baggett Rocks, which has been in process for as long as I can remember in the valley. They say it's supposed to be done this fall, but the original specs of that tower have changed. It's going to be shorter. We were worried that Saratoga was going to be in a hole when it was the original height. Now that it's shorter, we're pretty sure it's going to be in a hole. So I met with them with the option of possibility of putting in a WyoLink repeater onto our new tower out here. It'd be 800 megahertz. They came and toured the facility last week while I was out of town. Lieutenant Moore showed them around the tower, our IT room, all the infrastructure for that. So after the meeting yesterday, the issue of funding came up. So they are working on getting a quote for what it's going to cost. Really don't know anything. I've kind of come up with rough estimates anywhere from 20,000 to 100,000. So what I would like to do is actually put in for, it just opened this year's SHSP, which is the Wyoming State Security Grants, which is the grants we've used in the past to buy our portable radios, pagers for the fire department. That's some of the money that we use to pay for a part of the tower out there now. So I'd like to put in for the 2026, if I get the quote in time to help pay for putting in this WyoLink repeater.
When's that gonna be in?
It just opened. I think we have a few weeks on it. I just actually found out it just opened today, talking to Deputy Christian, because they're working on some stuff for the sheriff's office also. So just depending on the timelines on everything, I just wanted to get permission to apply for that grant.
Definitely,
Okay.
definitely. Do I have a motion to go ahead and allow John to apply for this grant?
Because also on this grant, I'd be trying to put in for a new building to replace our equipment shed up at the water tower also for our radio equipment up there for the water department and for the PD.
So it's, as long as we use it for communications and that.
Correct. I'd be writing it for communication and specifically for those items.
And who's it through?
State Homeland Security. They're big on the communication grants.
I say yes.
I'd make a motion to let you pursue the grant.
Do I have a second?
I'll second it.
Any more discussion? All in favor?
Aye.
Opposed?
All right, thank you. Other thing,
Put some pressure on them to get you a quote.
yeah, I will. We just met yesterday and they're gonna do coverage maps and get a hold of Motorola to put together the quotes. Because the most expensive parts are gonna be, most of it we already have in that they usually have to deal with because we already have our generator. Our generator will cover it. The power, I just have to reach out to Mountain West, check out the grounding they're gonna be doing on the tower because they have different grounding requirements for that. There'd be a grounding requirement in our radio IT room, which us being on slab, it would be no issue to drill through the slab and drive a grounding rod into the ground in there if we need to for it. And the other issues were fiber. We'll have two different options of fiber coming to the building for redundancy. All that part's already covered, and that's usually the major expenses.
Okay.
But I'm gonna reach out to, I guess Teton County paid themselves for 3 mobile repeaters, so I'm gonna get a hold of them and see what the costs were so we can get an idea. The major cost now is just radio equipment.
No, sounds good.
But then once it goes in, actually the state would take over all the maintenance and repairs of said equipment once it's installed.
Okay.
So there would be no future costs with it other than maintaining our internet connection, really. All right.
Anything else?
Yeah, we've been busy. School, of course, is back in session. So we've been running school zones in the mornings and afternoons and running the bus routes, to make sure everyone's remembering to stop when the signs are out and make sure everyone watches for kids running around in the mornings and afternoons again. Otherwise, Sergeant Lear got a letter returning him back to work August 31st. So once he's back, we'll be staffed, and I've got an interview coming up next week with the subject for the open position whose application I received when I got back from vacation. We'll
Good.
do our first interview with him, see how that goes, and then proceed from there.
Sounds
He's
good.
already certified out of another county in Wyoming.
Okay.
Otherwise, that's been what we've been up to.
Somebody you could put to work right away. That's,
Yeah, it'd be a short FTO.
Anyway,
It'd only be a couple week field training because he's got almost 20 years experience.
Good deal. Okay.
All right.
Any other questions for John? Thank you, sir.
Thank you.
I have nothing to report from the fire department. We'll move on to recreation.
Gentlemen, how are you?
Good.
So I don't have anything for you, so just an update. Pool is almost over. Pool season's almost over. We do have water aerobics through August 28th. So if anyone wants to come to that. And then our softball season, our last day is Thursday, championship games tonight. Good luck to that. And then youth flag football registration's out. It'll be due September 4th. Our season will be September 14th through August 15th or October 15th. Yeah, that's about it for me. So just getting NFL flag all set up and people registered and nagging parents to coach.
Okay.
That's it for me. Do you have any questions?
Nope. what I'd like to do is I'd like to, put Amelia in as interim rec director at this time, and then give us a little time to decide what we're gonna do. I've sat and talked to her. She is willing to start the process, and we'll go from there. Everybody in favor of that? Do I have a motion to do this?
I'll make a motion to put Amelia in as interim rec director.
Do I have a second?
So as interim, are you gonna open the position up for applicants or?
That gives us time to talk about it,
Okay.
to see if that's what we want to do.
Okay.
So, because really we haven't, you have to discuss stuff one-on-one.
Mhm.
But, I'll give you time to talk to your rec board, their feelings, and we'll just go from there.
I'll second it.
Any more discussion? All in favor?
Aye.
Opposed? Okay,
Thank you.
thank you. Okay, we'll move on to Department of Public Works, Mr. Emery.
Okay, I don't have a lot on the public works side as far as requests. I did want to give you guys an update on a couple of things. So in the background of our conversations, we have had the topic of PFAS in society. Microplastics is what they're kind of referred to. There are a series of substances that were created in the 1950s to resist water. They were used in clothes. They've used in a variety of products in our lives now today. That has kind of come up that's going to probably be the next thing that the EPA starts regulating in drinking water. Now that they've revised the lead copper rule, that's the next thing that they've rolled out. We were able to get some funding for our EPA required PFAS testing. We did finally get those results back just recently, and we don't have any triggering levels of anything in our water to any of the PFAS stuff. So I just wanted to let you guys know. So we don't have a lot of testing that's going to be burdened upon us as we go forward, or anything like that, or any treatment or anything like that.
Well, that's good.
Yeah, no, that was pretty exciting because there's only like 5 places in the country that can even test for it. Conversation about how you're even going to treat it if you have it. A lot of treatment systems aren't very effective at treating that. So that is a pretty positive thing for us in our water system. Sewer project, the bigger one for the river crossings, those bids are going to be due the 26th. So next meeting, I would assume Craig will have a bid tab probably by then, by the September meeting, review those and then decide what we want to do based on how those come back. So we do have the river and 2 ad alternates, kind of how we discussed setting things up. So we have a little bit of variability on how we award them. And then, as the mayor said, we are kicking over at the park. We should probably have the paving, I would say 90% of the way done tomorrow afternoon and then wrapped up Monday. Sod is planned early next week. The sprinkler system is in and operational. They're just tidying up a few things and they'll come back and sod everything up. And bathroom, all the rough and plumbing's done. Drywallers will be in Monday and then paint and tile shortly thereafter. So we're kind of all these things coming to a head and that thing should be done here pretty quick.
And it's looking better every time. Every time you drive by it.
It'll be nice. It'll be nice when we can get to the point where you just
Don't
take
see
the water.
cars anymore.
Yeah, and we can blow stuff off and wash stuff off and clean things up and whatnot. So do you guys have any public works questions? Okay. Moving on to planning and zoning. So I have one thing on the docket as far as an action item. This ordinance that I have on here is ordinance 894. So somebody submitted an application and historically we have always, if you have multiple lots, kind of let you use the aggregate of those lots to put a house on, right? So if you have two smaller lots, you know, you build your house and the interior lot line runs through your living room or whatever. Been pretty common. There's some on the overlook, some places downtown are sitting on 5 or 6 lots. My house is on several lots, and 90% of the time it's a non-conversation starter because you're never gonna sell half of your living room or try to dispose of half of your living room. So the topic kind of gets a little more, I don't know, use exciting or complicated, whatever adjective you want to use. If somebody comes in with like a multifamily development and that interior lot line ends up on a firewall, because then essentially you have two separate dwellings on two separate lots, and they could be sold separately or whatever have you. Like if you built a duplex or a triplex and you have lot lines on the firewall, where we were historically and always kind of doing the thing with single family and multifamily across multiple lot lines, it brought a gray area up. And so instead of trying to work in the gray area, me and Kylie kind of had a discussion about it. And this having an ordinance that clarifies how we handle those is the best way to go about it. And so I talked to the planning commission about it, had a public hearing, published twice in the paper. Last meeting, we reviewed this ordinance, and then they're bringing it to you guys just so we can address how we handle those, permit those, et cetera. And the only things in the ordinance that, as you guys see it in there, it's a 2-pager, but there's only a couple of lines getting added and definitions. Everything that's being added is underlined.
Questions on that? Would you please read it by title and we'll vote on it? You got it?
Yeah, it's in here. 894, an ordinance amending Title 18, Chapter 18.21, Section 18.21020, as well as Chapter 1824, Section 18.24020, as well as Chapter 18.27, Section 18.27020, as well as Chapter 18.06, adding Section 18.06.505 and adding Section 18.06.520 to the Town of Saratoga Municipal Code. This ordinance addresses multifamily, duplex, and townhouse development built across multiple lot lines and to provide an effective date.
Questions? A lot of numbers there. Do I have a motion to go ahead and pass this on its first reading? Ordinance 894.
I'll make a motion to pass ordinance 894 on its first reading.
Have a second?
I'll second it.
Any more discussion? All in favor?
Aye.
Aye.
Opposed? Okay.
Okay, and then are we still good for having that, you guys coming to the October planning meeting to kind of discuss Bridge Street?
Yeah, would you just send us out a notice via?
Yeah, I will after our next meeting. The planning commission's kind of reviewing some stuff and they'll discuss that in more detail at their September meeting. And I figured after that, I would kind of send you a synopsis of what we discussed. And so we're all kind of on the same page when we get together.
And that'll be your regular meeting in October?
Yep.
What date is that? You know?
It's Tuesday, the 11th, I think.
Because we know how hard it is to get people together in October sometimes. Right?
We'll do it.
Yeah.
Be October 13th. Tuesday, the 13th.
Okay.
And then we are still spraying mosquitoes currently on the Monday, Tuesday, Wednesday schedule. Probably depending on trap numbers here, we may kind of start reducing that and then just stick to the more localized areas that have bigger issues. Around town, as far as we can tell, we've done pretty good. There haven't been big of an issue. I don't know anybody right around their house in town.
No, I think they've been very nice. You're not gonna fly anymore, are you?
No, we got the 2 plane applications in and I was hoping for more, but that's just how they weren't in the state as much as they usually are due to the drought. They usually fly in Riverton quite a bit and then catch us. They're actually out of South Dakota, Iowa. They fly on that. They said they just weren't up in Riverton very much. So it was actually quite a debate to get the second flight here.
Well, good.
It was even too hot for the mosquitoes this summer.
No, we had them.
Well, you go out to the lake and let your dog run through the grass out there.
Yeah.
They go up there on the hill, right a little bit before dark.
Yeah, we had them. Some of them were size of pterodactyls.
Do you guys have any questions?
Nope, anything, nothing from the water sewer don't approach.
No, just the same things we went over with the sewer project, lead service line stuff that we talked about earlier.
All right, thank you, sir.
You bet.
Okay, we'll move on to Recreation Commission.
I don't have anything to report. I wasn't at the last meeting.
Chairman happens to be here. Do you have anything to report?
Here he is. I'm glad you brought up the internal. For hiring, so I'm curious like where you guys are going with that. How to see maybe that's not.
Okay, perfect. Thank you. We'll move on to the Saratoga Airport Advisory Board.
They did not have a quorum, so there was no meeting.
Okay. We'll move on to the Emergency Medical Service Board, and we have nobody here. I don't think we have a copy of their minutes either. We didn't get them this time. No. Okay, is there any new business to be brought before the town? Is there any further business? Do I have a motion to adjourn this meeting?
I'll make a motion to adjourn the meeting.
Have a second.
I'll second it.
All in favor?
Aye.
Meeting adjourned. Thanks, everybody, for coming.